Okay, all right, it is 12:01. We have a lot to cover, so we're going to go ahead and start. So as many of you may or may not be aware, I work at Aesthetic Solutions, and today's webinar is going to focus on navigating skin and hair changes in menopause. So this is a huge topic. I tried my best to pick the top complaints from what people have told me, from what patients complain about, so we can go through them all. And so at least you can leave this with all the high-end pearls. You understand a little bit about the changes you're experiencing. Before we dive into it, I just wanted to introduce myself. Some of you may be patients of mine or patients in the clinic. Some of you may be completely new. So my name's Dr. Kamrani. I go by Dr. K. I am a board certified dermatologist. I did an extra year of cosmetic training, so injectable, lasers, veins, and other types of procedures after residency, and spent a whole extra year in California learning and perfecting those skills. I grew up just right down the street in Chapel Hill, North Carolina. I'm very happy to be back now in Chapel Hill. I went to NC State for college. I was up in Pennsylvania for medical school and residency, and then California for the fellowship. There are a lot of things. I like to say I love all things skin and hair. I really do. I do a lot of hair loss, lasers, injections, vein treatments. And I'm also very involved with research, been involved with many clinical trials, published research paper and textbook chapters, and also have done a lot of lecturing as well. So this is our goals today. We're going to talk a little bit about what menopause is, what changes are going on in the skin and why, things that you can do at home and things that I can help with, and then we're going to do it all over again, but talking about hair. And then at the end, I'm going to give you guys some resources about menopause, just to read more about it from reliable sources, because there can be so much information online and it can feel a little overwhelming. So it's just nice to have a good resource that's been approved. Great. So why is even a dermatologist even talking about menopause? This is a question one of my family members asked me. And I think dermatologists are the most important people that should be talking about menopause, because menopause is a full body transition. It's not just what's going on in the brain and the heart, hot flashes, things like that. It's also skin and hair changes. There are many changes that happen with that. And dermatologists, that's what we see all day, every day. So there's been a huge push probably over the last 3 years in dermatology conferences and lectures on this topic of menopause. I just came back from MCAS, which is the biggest cosmetic conference in the entire world in Paris, and there were so many lectures on menopause. And this is a photo from a panel that I attended that over 500 dermatologists were learning about skin and hair changes with menopause. So a lot of the information I'm going to share with you guys today came straight from that lecture that was educating all the dermatologists and all the new data across the world. And then I've also published on this topic. I was really fortunate to be involved with some experts on talking about what aesthetic considerations, what treatments, and what to consider for people that are peri and postmenopausal. And things are changing. You know, what you were told maybe 10 or 15 years ago may be very different than what we know now. PubMed is a resource where all the research is published. So somewhere where you can search, kind of like a Google of research, and you can see the graph going up exponentially. So this is evolving. Every year there's new information coming out. So even if you went to your doctor and talked to someone about this a few years ago, I think you're still going to learn some good pearls today, because there's some stuff we didn't even know. So first, let's understand, why does your skin feel so different? And we're going to focus on this graph right now. If there are any OBGYNs, listening to this, this graph is very simplified and it is a much more complicated process, but we're going to simplify it to this graph here. So once you hit around 40s, it could be even late 30s, mid 40s, you undergo what is called perimenopause, around menopause. And what is happening is your hormone levels are fluctuating. They're overall going down, as you can see by the downward turn, but they're spiking. They're going up and then they're going down. They're going up and they're going down. And this whole process can last years. The average is 4 to 8 years. So you might be going through menopause changes and be having a regular period. You might be skipping a period. You might have some symptoms like brain fog, but you're not having other symptoms of menopause. And that's what makes this so kind of difficult, because the symptoms are very nonspecific and can be very easily just brushed away and not be correlated to this perimenopause phase. So 1 month your hormones are high, 1 month they're low. It can be a very difficult time of transition. The same thing is happening with progesterone as well. Then there becomes a phase where we call this menopause. So this has a very key term. It is basically the day that you have not had a period for 12 months. That day is like a birthday. Okay, I'm in menopause now. So that you haven't had a period for 12 months, and that is when estrogen has reached its lowest point. So it started off high, it fluctuated a lot, now it's really low. And then after that, we call it postmenopause, after menopause. So this is when the curve starts to flatten. It's not as fluctuant, it's still low, but it's reached this new steady state, and your body has adjusted for this new lower level of hormones. So your symptoms improve, they might not be as severe, some may go away, some may be a little bit more mild. But actually during this phase, this is when a lot of the skin and hair changes become more apparent. So I love the science of things. I think it's really fun to understand the whys, and I will not go too into the weeds with this, but I think if you understand the why, it is a lot more motivating to know that the things that you are experiencing and seeing are not just, you're not going crazy. It's a little validating in a way, because there is science to back everything that patients are telling me and that patients are experiencing. So it all starts with this friend. This is called the fibroblast. Dermatologists love fibroblasts. And a fibroblast is a cell in your skin. In estrogen, the hormone that is going down in menopause, there's a receptor on the fibroblast. So estrogen will activate and stimulate and make the fibroblast do its job. And what is that job? It is what makes collagen. So that's what makes your skin feel firm and thick. It makes elastin. That's what allows your skin to feel tight and bounce back. And then it also helps with hyaluronic acid. You guys may be familiar with this term. It's in a lot of skincare products, and that helps with hydration. So now when we're fluctuating and going through menopause, the estrogen levels are going down, and that leads to a decrease in all of these things because the fibroblast is not being activated. So what does that mean for you? If there's one pearl to walk away from and to kind of think numbers, in your first 5 years of menopause or at postmenopausal, you've lost 30% of your skin's collagen in the first 5 years. So that first 5 years is a very crucial time, and it's where a lot of people are starting to see changes. After those 5 years, your collagen is going down by 2%. So if you were 50 years old and then you are now 60, you have lost about 40% of your collagen in just those 10 years of your life. Now, not only is collagen being lost, estrogen helps with bones. That's why postmenopausal we get osteoporosis, because the bones are not as strong. And the same thing can happen in your face. So the bone in your face starts to get smaller. You might start to notice your face structure looks a lot different. The skin is not as supported. It's starting to drape down and sag. And that's because what was underneath it, the structure, is not as big as it once was, and so the skin starts to sag down. Now, let's not get too technical. So what does this mean? What are we seeing? So this is what leads to the skin being very thin, especially around the eye area. Wrinkles, skin crepiness, sagging that can happen. These are very common things that we see in the office that we can help with. And it's not only just with the fibroblast. Estrogen is also helping with skin hydration. It helps with what moisturizes our skin that adds to more hydration. And most importantly, it helps build what is called our barrier, our skin barrier. It helps provide the lipids to help protect our skin. So one common complaint that people talk about is my skin is more red, it's more angry, it's more inflamed. products I used to use all the time don't work for me anymore. And that is not because of something you did. That is truly because overnight, really, there was a change in the structure of your skin. So it's not that you have bad skin, it's just that your skin has different needs now. And so we're here to help guide you through what those needs are. So I'm going to spend a little bit of time going through some of our favorite skincare products here in our clinic and talk to you about why we love them, why we've picked them, and then we'll go through some other things after that. So first, starting with serums. So when we're thinking about menopausal skin, it's always exciting when skincare products actually study it in people that are postmenopausal. So we have a lot of medical grade skincare. That means that the companies are elsewhere have done studies showing that this product works. And Impel is a great example of that because their study, they made sure that all the patients were postmenopausal. I think their average age in their study was 57 years old. So that means that the results that they saw didn't correlate to someone who was in their late 20s using it compared to someone who were in their 70s. So anyone that is peri-postmenopausal, we recommend the Impel serum and the night cream as well. So the serum helps with skin radiance, it has nicotinamide peptides, it's very lightweight, it's very hydrating, and it can help with firmness and brightness without drying out your skin. And you can also pair this, there's a QR code for a link with more information about it through our skincare store. Also the night cream, we pair this commonly with it as well. So also studied in estrogen deficient skin, so skin that doesn't have a lot of estrogen. And this has the technology called MAP. So MAP is essentially, they have figured out the ability to stimulate the estrogen receptors on your skin, but they don't have any estrogen in them. So this is completely non-hormonal, but can have the results of what putting topical estrogen on your face can do without having any risk of systemic absorption. This does have a retinol in it, so that's why it is at nighttime, and the retinol can help with fine lines, dryness, and dullness as well, but it also has a component of hyaluronic acid, so it's not drying, it's more hydrating. A menopause skincare tip is anytime you're adding retinols to your skin, it's always best to sandwich it. So what that means is you do a moisturizer, so you could do a thick moisturizer, you do your retinol, and then you do another thick moisturizer on top. So essentially you are sandwiching that retinol in the thick moisturizer, and that somewhat dilutes it, but it also helps with hydrating the skin because a lot of people get dry and irritated when they overdo it on retinols. Now, this is only at night. I wouldn't use it at the daytime because retinols may make your skin a little bit more sensitive to sun. So it's always best to do it at nighttime so it's fully absorbed before the daytime. The daytime, one of the ones that we love here for menopausal skin that is very dry, very inflamed, is the Trio Luxe. This is called Trio Luxe because it does three things. It attracts water, it holds in the moisture, and then it also strengthens the skin barrier, and that is what gets disrupted in menopause. And it doesn't clog pores because acne is another thing that can happen too, and we'll talk about that as well. So it's a balance between something that is thick and hydrating but will not flare acne. And then we're going to talk about longevity. So longevity, the concept of kind of regenerative medicine, trying to repair the cells to live longer and live better, is where the future of dermatology is going. So this is a really exciting change that we're seeing, that we're focusing a lot more on what can we do to help the cells that we have live longer and healthier. So going back to our friend, the fibroblast, we already know that estrogen and also aging plays a huge role in this cell. So what happens is over time, this cell starts to get really tired. Your fibroblast in your 30s is very different from the fibroblast in your 70s. They are not producing the same amount of collagen. And really, we do lasers, we do a lot of things, good skincare, sunscreen, to help reverse this. but there's now been a new product called ReQ, which its only job is to reverse this. So let's talk a little bit about that. So ReQ is a skincare product that now we have in the office that is a serum. It's twice a day. And what it does is, if you look on the photo on the left, these are the fibroblasts that are tired, they're exhausted, they're old, they're not producing collagen. After 2 weeks of using ReQ, it was able to reverse those signs of aging on the fibroblasts to make them back to their normal, healthy shape. So this is a totally different way of thinking of things. You know, we are not directly stimulating collagen. We are giving the cells that make collagen the environment that it needs to go back to what it used to be able to do. So it's something very exciting. We're one of only the few practices in the nation that have this product. And it's been really great to pair it with a lot of the in-office procedures that we do. And even more exciting, one of you guys that are currently on are going to receive a full-size product of ReQ. So I have it in my office, and we will contact you right after the webinar to let you know that you've won and you can get started. Okay, so going into the tips. I will preface that everyone's skin is very different. So these are kind of vague because it's really not a one-size-fits-all approach, but these tips I would say pretty standard for most people. The first thing is, you don't want to do a lot of irritants, and you do not want to do alcohol on your skin. So if you have a product that you put on your skin and it burns, that's not normal. It shouldn't do that. So there might be a component of alcohol in it or some sort of preservative that your skin is not liking. So you want to look for fragrance-free, alcohol-free. Those are less likely to disrupt the skin barrier and less likely to worsen redness and dryness. And then please, no hard scrubs. Like if you are using St. Ives apricot scrub or anything that has a lot of beads in it, I would just stop right there. There are other ways to exfoliate that aren't a physical scrub. There are different sort of AHA, BHA acids that can be done that have the same effect and aren't going to disrupt your skin barrier. The next tip is hydration is the key. All of these things, everything with skincare really that we're trying to do, hydration is one of the top things that we try to do. And in sandwiching the active ingredients, mostly your retinol, is the best way to balance getting a retinol into your routine and maximizing hydration. I have a lot of patients that cannot do retinols. They've tried over the counter, they've tried prescription, they've done the sandwich method. Regardless, it doesn't work for them. If that describes you, there is a product called Melatonin, which does not have a retinol in it, but it has bakuchiol, and that has been shown to work like a retinol. So it helps with stimulating collagen, turning over the skin faster. It also has a vitamin C in it, so it's an antioxidant as well to protect you from the sun rays from hitting your skin. So that could be something that you may have good success with. And because it doesn't have a retinol, it's safe in people that are pregnant or breastfeeding, because retinols you cannot do when you're pregnant or breastfeeding. Always test products. You might have used a product for years and it was great and wonderful, and now it's not fulfilling the needs that your skin has. So whenever you have a new product that you want to use, even if it's a shampoo, a conditioner, a sunscreen, makeup, it's always best to do a little test spot. You can do it on the side of your cheek. If you want to be really good and on top of it, you can go to your inner arm and put it twice a day for about 5 to 7 days. If you get a rash in that area, if it burns, that's a good idea not to use it on your face, and at least you learned it that way rather than rubbing it on your full face and dealing with a painful, irritated rash. Gentle cleansing. So cleansers are not, they don't need to be very complicated. So something that's very gentle on your skin that does not strip the natural oils and does not destroy your skin barrier. So there's a lot of information about double cleansing. This is when you do an oil-based cleanser first and then a regular cleanser afterwards. This is best for people that have that put a lot of makeup on, that needs the 2 layers in the oil-based cleanser to really get the makeup off of their face. But if that doesn't describe you, you don't need to double cleanse. Even though an oil-based cleanser isn't as drying, it's still cleansing your face twice, so it is going to be drying in the long term. So it's, for most people, you don't need it, just a very simple cleanser. And then I wouldn't be a dermatologist if I didn't talk about sunscreen. So sunscreen is not going to slow down menopause at all, but it is another way that the collagen is being broken down. So it is something that you can incorporate into your routine to help save your skin, to help reduce your risk of skin cancer. And if you're someone who's prone to pigmentation or melasma, make sure your sunscreen is tinted. That will work better for you. Wonderful. So those are some tips of things that you can do at home. Now, what can I do to help you through this process in the office? So there are a lot of things that we can do, and I've tried my best to just go through some patient examples and to simplify it, but I don't want anyone to get overwhelmed by all the options because that's what we talk about in the office and we decide, but I just want to show some things that are possible that maybe you weren't aware of. So we treat a lot of collagen loss and wrinkles. We can do this with things called biostimulatories. These are treatments that help increase collagen. They are not fillers, they are injectables that help your body create more collagen. Lasers as well, things like wrinkle relaxers in certain areas such as Botox can help soften a lot of lines that you might have seen develop. Skin quality and texture. Out of anything, skin quality and texture, I would say is the #1 thing because, that is the first thing that people see. That's what the skin can be in a kind of reflect health in a way. So if you have really good skin quality, you're going to be perceived as more radiant, more rested, more healthy. And that's where lasers, microneedling, and really good skincare come into play. And lastly, volume and structural support, because that bone is getting smaller with time. And if you think of your face like your bone is a table and your skin is a tablecloth, the table continues to shrink. It's shrinking over time, but your tablecloth is staying the same. So of course the tablecloth is going to start to drape. It's going to start to sag over the smaller table. So that's where certain treatments like things that stimulate collagen or hyaluronic acid gels can help support the structure to take it back to what it once was. So I think the best way to go through it is just examples and talking through it. So these are photos from patients from our office. So this was a patient who was really bothered by some collagen loss, brown spots on her chest. We were able to treat those and address them with a combination of 2 different laser treatments that were done on the same exact day. This is another example, eye crepiness, wrinkles around the eye. The eye is the thinnest skin in the entire body. And it is also an area that is very prone to collagen loss from menopause. So we have a lot of different things that we can do to help. This patient had 1 treatment of a CO2 laser around the eyes. What that does is it allows for the body to create more collagen in that area. So her skin there is thicker, so you don't see the lines and folds. It's not as crepey or as translucent as what it once was. You can get it around the mouth area. So some people call these smoker lines or barcode lines, even though you may or may not have ever smoked and you still get these lines. They're very common in this area. This patient had a CO2 laser around the mouth. And then because she was most bothered by sun damage on her cheeks and the rest of her face, she had a Fraxel laser, and that's what helps with sun damage. It also has been shown to reduce your risk of basal cell and squamous cell by about 50%. Those are the 2 most common types of skin cancers, because by doing this laser, you are removing the precancerous cells and the sun damage that has developed there. And then I just wanted to talk a little bit about our signature treatment. So this is called Rewind Time. So Rewind Time is only available at our practice. And what it is a combination of 4 to 5 different lasers that I pair in a single treatment. So you come in on a single day and we can address the redness, the brown, lines around the mouth, around the eyes. We also pair the neck and chest with it. Now, everyone's treatment varies based on your needs, on what areas you want to focus on. So I can't even give you the exact lasers because it depends on, what you want and what your goals are and what I believe the lasers will help most with. So this is something that's only available in our office, and we'll be happy to talk more about it. Biostimulators, these are things that help stimulate collagen production. So this patient was really bothered by skin sagging, thin skin, and it was significantly improved by doing 3 treatments of Sculptra in the area. This is a product that helps stimulate collagen. You can see that these lines that were in the corners of her mouth have almost been, completely gone just by doing a product, and she still looks like herself. She still looks really natural. She just doesn't have what we call those marionette lines in the lower face anymore. We also do this a lot in the cheek area. So some people may develop little lines that are on the corners of their mouth here. We call these radial cheek lines. And there are a few different tips and tricks that we have to treating those, including Sculptra injections, because that will help stimulate collagen underneath to help improve the appearance of those lines. And the best treatments come from combination treatments. So everything is better when we do a combination of different things because there are many different layers to the skin and they're all aging at different levels and they all have different treatments. So when things start to look a little unnatural or catch your eye, or they start to distort your normal kind of face structure, that is when one of the treatments may have been overdone. So it's really important to go to someone that has experience doing lasers, injectables, all of these things, because they're able to offer you a very comprehensive plan and not just continuing to treat all aspects of aging with one product over and over and over again. Because in reality, there are so many different things that can be done, and usually it's having to do a combination of them to really get the best results. So this is a fine example of that. This person did some wrinkle relaxers, did a little bit of filler, and then did some biostimulatories to help with collagen production. You can see that she still looks like herself. She still has appropriate lines for her age, but she just looks more rested, not as tired, and they were able to help mask some of the changes around her eyes as well. This was a patient of mine. She started to feel very hollow. She was concerned about her temples, felt like they were caving in, and she felt kind of like her structure of her face was changing. And even underneath her cheekbone, she felt like she was just getting very hollow, even though she wasn't losing any weight. It was all the healthiest she's ever been. So we treated her with a little bit of filler or hyaluronic acid gels in her temple and her cheeks, a little bit to support the lines around her mouth, and she looks great, still looks like herself. We're just able to reverse some of those signs of aging. And there are also some fun areas that we can treat too. Collagen loss is not just the face. I feel like I've only talked about the face, but it's happening everywhere. It's on the body, the neck, the chest, the hands, and even the ears. So this was one of my patients. We had a little extra filler left over, and she was like, well, my earrings don't really stay in my ear. They sag down. And I said, I can help you with that. And so just with one session, we were able to restore the natural curve to her ear. And so she could still use her earrings and they were more supported. Hands are a very common area that we treat too. We can do these with products that can help stimulate collagen, such as Radiesse. We can also do it with lasers to help with sunspots and photo damage. All right, so talking a little bit about acne, we're going back to some skin things. Acne, you always think about it with people that are going through puberty, but it's very common postmenopausal. It's about 40% of women deal with it. And that is because your estrogen is going, it's that graph, it's plummeting down, but your testosterone is actually only slowly decreasing. So it's a hormone imbalance. So it's not that one is super high compared to what it should be. It's that the ratios have shifted. There's an imbalance now from the estrogen and the testosterone. So now we have more of these androgens in our skin. And what happens is this helps by stimulating oil glands. Then we have more oil, which leads to more inflammation, more cell skin turnover. So you start to get acne bumps in the jawline and the chin, and this might even be you never had acne before, or you maybe had a little bit of acne and wasn't too bad, but now around your 40s, you start to feel like you are going through puberty again. And there's a lot of different things that can be done, and really it depends on the severity of the acne, where it's located, what things you would want or open to doing. But I put all these options here because there are tons of options, and some of them involve in-office things. We have a great laser called a V-beam that can help with the redness from the residual acne spots to help speed up the recovery. I prescribe prescriptions for acne as well. Specifically, spironolactone is a very great medicine that can help with hormonal acne, and that is something that I've been doing a lot more frequently now. The biggest tip here is just making sure you're not over treating. So we like to start slow, maybe add 1-2 products, because the worst thing you can do is we try to do everything here, and then your skin gets really dry because that barrier is not responding as quickly. Your skin doesn't heal as quickly as what it was before menopause, because estrogen helps with wound healing. So we have to start slow, and the goal is always having a good moisturizer on board and making sure that we are not over treating, especially the rash around the mouth is a very common area that people get dry. All right, great. So we're doing really good on time. We're going to transition here now to hair. And I'm just going to pause here for a moment so this percentage kind of sinks in. So 80% of women have hair loss by the age of 60. So this is a lot more common than you think. And I think either people don't talk about it, or people are scared to talk about it or see a dermatologist about it because they think that it's done for and there's nothing that can be done. But it's a very staggering number. And so we're going to go through some things that can actually help, and it is a treatable condition. So the actual medical word for this, very long, androgenetic alopecia. I just call it female pattern hair loss. So there are many different kinds of hair loss. So this diagnosis specifically should be made by a dermatologist just to make sure you don't have another kind of hair loss that has a different kind of treatment. And that's why I actually, on these slides for hair, for the hair loss specifically, I didn't put any at-home tips, because it's so important to get the correct diagnosis first, because the last thing you want is you're doing something at home and it might not be the best treatment for the type of hair loss that you have, and now we've delayed your care a little bit and we could have been doing something better for you sooner. So one question I always get asked, males versus females. So males have a different pattern. So women, when you start to lose your hair, it first shows up as just overall thinning. Your hair feels thinner kind of everywhere. And then your scalp is more noticeable. You can start to see your scalp through the individual hairs. You might start to notice your part line used to be very thin, and now it's a little bit wider. And then you might even notice that your temples, the hair is receding a little bit more back, similar to what happens in male patients. But females overall typically do not get the full front of their hair start to lose compared to like what happens in male patients. This is a really good schematic, and it is not like a time schematic. So it doesn't mean you're going to go from the first all the way to the last. That's not at all what happens. It's not there to scare you. It's just showing you like mild hair loss, the most extreme hair loss, how it happens. So it's very, very, very rare, unless there's something else going on, for a woman to go completely bald from this kind of hair loss. And it's all got to do with that hormone imbalance again, just like the acne. That testosterone is kind of higher than the estrogen. There's this imbalance. The testosterone creates this other hormone called DHT, and that binds the hair receptors and makes them thinner and makes them grow not as quickly, and it makes them shed. So a lot of the medications that can be done work on preventing testosterone going to DHT, so then it cannot bind to the hair and make those changes. Now, it is genetic, it is hormonal, and there are other risk factors too, PCOS or other types of things that if you have high androgens, high testosterone, you may be more likely to develop this. So how can I help? There are tons of different things for hair loss. And because of that, it's really our first appointment is going through tons of different options because I want you to know everything and you can decide, or we can decide together what's best to start with, what are our next steps, and going from there. So starting with topicals, maybe some of you have tried Rogaine. Rogaine is an over-the-counter topical product. I put men's here specifically because you can use men's. So don't even waste your time or money with women's Rogaine. The men's is a higher strength. It's only once a day and it works just the same. So women's is twice a day and it's a lower strength. I don't know why. It's just marketing. So go with the men's if you're going to start this process after seeing a dermatologist. Hair shedding is very normal, it's very common, and it is temporary, and it does take several months to start to see full effects. One tip that a patient recently shared with me that I haven't tried personally yet myself, but I still wanted to share with you guys because maybe it will help someone here is there are these minoxidil applicators on Amazon where you can pour the solution in if you do the solution over the foam, and it can help like you squeeze it and rub it in, and it's a lot easier to put in your scalp every single night than using the dropper and then it's getting all over the place. This you can squeeze and rub it in and you can do your whole scalp applied in less than 30 seconds. There are prescription medicines as well. There are different medicines that work on different aspects of hair loss because there are multiple different pathways, so there are multiple different ways to target it. So minoxidil, finasteride, spironolactone, these are all things I talk with you in the office, and really it depends on the severity of your hair, your medical history, and what your needs are to decide if you're a good candidate for some of these options. Nutrafol Balance, these are a nutraceutical, so a supplement that's been formulated for hair loss in post-menopausal women. That's what the Balance is. And so the difference between this and normal Nutrafol is that they have a higher emphasis on different products that can help with stress-related hair loss too. So they study this in people that were post-menopausal, so this could be a great option in addition to other things that can help with the hair shedding, and it would just replace your multivitamin and your vitamin D. It's great. And PRP is something that we do in the office. So PRP basically is you come in, we draw your blood in the office, and we spin it down, and we actually take your growth factors from the top. So in your blood, there are many platelet-rich derived growth factors, about 8 of them, and we can take them and inject them directly in the areas you're having hair loss and hair shedding. So the nice thing is it's very targeted. I focus on areas where you're having the shedding. We can change the areas we focus on each treatment. It's not something systemic that you have to take at home or a pill or a topical that you have to do, even though it has been shown to work even better if you're doing something else systemic with it. And it's your growth factor. So it's your own blood. It's no one else's. Just going and it's helping just to target that area to stimulate more blood flow to help the hair grow faster and thicker. People that are not good candidates for PRP usually are people that may not have a lot of growth factors, and those are people who are pretty ill, or very sick, or going through chemotherapy. Those are reasons that I would not recommend PRP. And I'm going to highlight on some of the cases of people that we've done in the office. Typically, you need anywhere from 3 to 4 treatments, spaced a few months, 4 to 6 weeks apart, and then you do need maintenance treatment because there is no cure for this kind of hair loss. It is all with maintenance, so we have to maintain the results. So unfortunately, it's never a one and done that comes with hair. And this was an example of a patient that was doing Nutrafol Balance for a year with great results. And then last but not least, changes in hair texture. This is something that people talk to me about almost every single day. And I'd say these are the most common complaints, issues that I hear about. So probably these are something that maybe you guys are experiencing as well. So your hair is starting to feel more dry, more brittle. It's lost its shine and it's not as smooth anymore. It's more frizzy, more wavy, and your styles aren't holding as well as they used to. And why is all this happening? Well, it does come back to the estrogen in menopause as well. So estrogen, what's going down during menopause, It helps with oil production in the hair. It helps with providing your hair shaft, the actual structure of the hair, with the lipid coating around the outside of it that gives it its shine, its thickness, its smoothness. And then also it helps with the hair growth phase as well. So when we're decreasing estrogen, we're also decreasing all of these things as well. So I know this also, it seems also negative, but I want to highlight that if any way maybe it could be a little validating that some of these changes you're seeing is not anything you're doing, but there is a hormonally science-based fact reason why you're experiencing this. And these are some good tips that I think everyone should incorporate into their hair. So washing it less frequently, it will the hair will not be as dry, the scalp will not be as dry, so it provides a better hydrated environment for the hair to grow. Sulfate-free shampoos or conditioners, and conditioning regularly. So conditioners help add hydration back to your scalp. Now, you don't need to condition your roots. You can just focus on the ends of your hair because this is where it tends to get dry because your roots are still getting the sebum and oil from your scalp. So when you're using a conditioner, you really just want to focus on the ends of your hair. If you do too much at the top here, your hair is going to be very oily and it might actually you might think that you can't handle conditioner, your hair gets too oily, then you need to wash more frequently. So just focusing on the ends of your hair, you can do even a leave-in conditioner or a leave-in oil like argan oil can help hydrate and help with the frizziness and adding extra hydration to the hair. And then reducing damage. So this comes with heat. If you're going to do anything heat-based, using a heat protectant spray every time. And then avoiding tight hairstyles, especially tight braids where they pull on the very fine hairs of your temple. This area is so prone to breakage. So if you're doing very tight hairstyles, tight braids, tight ponies, slick back buns that are very tight, that is going over time going to lead to more breakage, and it can actually lead to permanent hair loss in this area that is very, very hard to treat and regrow. Switching to a silk pillowcase, and then gentle brushing, especially when your hair is wet. You don't want to do anything too forceful. I always recommend starting just with the ends of your hair, brush it there, and then slowly work your way up. So when you're, instead of starting from the top and pushing really hard down, you're not putting as much force on the areas that could break your hair pretty easily. And then if you want more information, I am not an OBGYN, I am a dermatologist. So I know the hair and skin very well. There are a lot of good resources to learn about the other aspects of menopause, what affects your brain, your heart, your bones. And so I think having a team involved, especially going to see your OBGYN to discuss this, is so important. The Society of Dermatology put out a really good tips about caring for your skin in menopause. A lot of them we highlighted here, but if you want a resource to read through, just pull out your phone, you go to the camera app, you don't need a special app. And if you just hover over this QR code on the left, there should be a little yellow link that pops up on your app. If you just click it, it will come up with the link, or you could just Google exactly this caring for your skin and menopause tips. I believe it's the first link that pops up. So those were made by dermatologists, a great resource. There are some really good podcasts out there too. This is a link to one that I recently listened to that I really enjoyed that talks about the importance of strength training, muscle, and doing all of those things to help support your muscles and bones during this transition as well, because that is just as important, if not more important, than your skin and hair. And also they did a study, and people that do more strength and resistance training had more collagen in their skin. So every time you're working out, you could think, okay, this is also helping my skin. And then lastly, I know there's so much about hair and I wasn't able to get through all of it just due to time, but we did do a full, almost an hour webinar on hair not too long ago where I go through a little bit of what I talked about today, but I talk about other kinds of hair loss and go into the science a little bit more. So if you go to our YouTube channel, you can listen to that too, just so you don't, I don't want to brush through hair. It's very important. And then lastly, kind of next steps. So if you are interested in coming to see us in our clinic, we are located in Chapel Hill. And we do kind of all the things aesthetics. We do injectables, we do lasers, we do peels, microneedling, skincare. We are a research center where we constantly have clinical trials of the latest and greatest products that are being studied. So we are a one-stop shop for all of those things. We've been recognized as a center of excellence, and there's only 6 dermatology clinics in the entire nation that have that Center of Excellence nomination. So we were really excited to receive that this year. And then what does the cosmetic consultation look like? So you can do a cosmetic consultation or a hair loss consultation. And really, my main goal with that is education, because that is the biggest thing. If you understand the why, then it's really, we're all more motivated to do things that can help it, because we understand why it's going to help and how it's going to help. We do a very thorough skin analysis where we look at different scans of your face in different views. So we have different platforms that can pull out all the reds of your skin, all the browns. We have different platforms that can actually, it's a device that can basically have a photo that removes the top layer of skin. We can just look at your bone structure underneath. It's a very cool way of seeing your skin and your face in ways that you've never have. We talk about your goals, your concerns, what we can help with, and coming up with a really good plan and a good skincare plan as well. I gave enough time to hopefully go through some questions. If you want to learn more or want to follow along, we have our Instagram handles, our clinic, and then mine as well. Does skincare with any form of estrogen increase estrogen levels in the blood? So this is a really good question, and actually I'm so glad that you asked this, because I wanted to talk about this. We don't prescribe topical estrogen in our office for facial rejuvenation. A lot of people do. We don't, because technically, yes, there can be systemic absorption from the skin into the body. It depends on a lot of things, like how often you're using it, the amount of surface area, which exact product, and its concentration. And because it's so variable and there's unknowns and the potential that you could be ingesting a systemic hormone, us as dermatologists, that's not really our go-to. So that's why we brought on Impel in our clinic, because it doesn't have any hormones, but it still is able to bind the estrogen receptors and do what estrogen would do without actually being a systemic or topical hormone. What about serum, then retinol, and then moisturizer sandwich? I think that's perfect. I would do the serum first. So you wash your face, dry your skin, serum goes on first, and then you do your moisturizer, then you do your retinol, and then you do the sandwich, then you do the moisturizer on top. So serum's first, and then you do the sandwich. And actually, what you can do is you can stagger that. So starting every 3 days to every other day, and slowly building yourself up to every single day, because it does take a little bit of time. So I would say 99% of people, I might change it. I say do it every 3 days for 2 weeks. Then you do it every other day for 2 weeks. And then it's been a month, you do it every single day. And I haven't had anyone that's had any issue with that. You probably could do it a little bit more frequently, but that way is really safe. Can you compare ReQ to the other serums? So ReQ is very different. So it works by stimulating the cells that make collagen so they can work better. So I like to think of it as it's actually not replacing anything, and it's not a substitute for anything. It's just additive. It is a totally different way of skincare, because up until this time, everything we were doing was trying to stimulate a cell that was tired and worn out. And so this has given us the ability to kind of reverse those signs of aging. So I can't really compare it, because I would say to do both. Is there anything that will help with thin skin on the forearms? I can barely bump something and I get blood spots that take forever to heal. So this has a medical word. We call it solar purpura, and it's basically from losing collagen and support on your skin. Your skin gets really thin, and the collagen support around the blood vessels and veins of your arms, of your hands, they're not there anymore. So the lightest tap can basically completely kind of bruise that blood vessel there, and so you're just constantly dealing with little bruises that can change. There are a few different things that we can do. My go-to is doing a laser therapy that targets on stimulating collagen to help thicken the skin. So we're giving more support around the blood vessels. So if you hit it, it at least has like this bouncy protective layer around it. What is the recovery time for CO2 treatments around the eyes and mouth? So we have two different CO2s here, and based on, the severity of your lines and the downtime that you have, it dictates which one we do. We can do fractional, which means only a portion of your skin is being treated and a portion is not, so you heal faster. That is probably about 5 to 7 days, maybe more 7. And then there's fully ablative. That is the whole skin is being treated. So that has more robust results. That has more of a downtime of 10 to 14 days. So it really just depends on, the downtime you're able to have and kind of your goals. We talk through that. Nutrafol balance is great. The biotin, it isn't good for people who have thyroid issues and also contains turmeric as well. So I'm really glad Teresa brought this up, and I talk about this in depth in my hair loss webinar as well. So Nutrafol, all of Nutrafol's products except the vegan contain biotin. So biotin has kind of used to be thought to be the best and greatest for skin, hair, and nails. Now the evidence is showing that that's probably not true, and so they're actually working towards removing biotin from their product line. But what biotin can do for some people is it can make the labs look different, especially thyroid and troponin. It can change the labs as well. So it's not that it won't change the actual thyroid levels in your body. It just disrupts what comes up on the lab level. So anyone that's have a history of thyroid issues that get a routine thyroid blood work, I do not recommend they take it. Anyone that has very high vitamin D or prescribed a vitamin D supplementation by their doctor, I do not recommend they take it because it has vitamin D in it. And then if someone is getting their routine blood work, their annual thing, I just tell them to stop their Nutrafol about 5 days before. Are colored light therapies effective for hair growth? So I think this is talking a little bit about red light therapy. So red light therapy works well for hair loss. Now, red light therapy has been shown to help. It is not going to completely regrow hair. It is one thing that can help that you do at home. It's very safe. There are a few FDA cleared devices that can help with it, like hair mats or Revian cap, that they've actually studied it to help. I never recommend red light therapy by itself, just because I know adding other things will give us the best results, but it's something easy that can be done at home and fairly safe. The only people I don't recommend doing red light therapy are people that might be prone to melasma, because there have been some reports of red light therapy or any sort of light can flare melasma. Red light therapy for the face as well can be helpful for facial rejuvenation. We have one in the office here that's FDA cleared that has 6 different light colors to it, so you can adjust it based on your needs that day, whether it's red light, blue light for acne, anti-inflammatory, and we've had really good feedback from patients and staff. We have one for the staff here that is just constantly being thrown back and forth, different staff members, that's been shown to really help. Dry, crepey skin on the arms and legs. So first starting with like a body retinol can help thicken the skin. And then it really just depends on the severity and the location. Sometimes we do a laser, sometimes I do some Sculptra that's really blended to get the whole area to help stimulate collagen in that area. So it depends on the location. Hair transplants, what are my opinions? So hair transplants, I don't do them, so I can't counsel them too much about if you're a good candidate or not a good candidate. Only someone that does them every single day can do that for you. I have spent some time with a hair transplant doctor in Charlotte just to learn about what goes on through the process. And I would say that it is a great option for a lot of people. It's very effective. It's a little bit, cumbersome that day of treatment, but it's a very effective treatment. But it doesn't prevent anything else that we talked about. So even if you have a hair transplant, you still need to be on something to help with the hair, because we're not curing hair loss. We're just resetting the clock. We're resetting the hairs that we have. So you may still need to do PRP. I do a lot of patients that have had hair transplants either locally or out of the country that come in every few months for their PRP to sustain, or we have them on prescription medications to help maintain the hairs that are there. To learn the best options for me, would I schedule a consultation with the physician or the PA? I would call our clinic and discuss with our team there. It could depend on your concerns and the goals of what treatments you want. We have some amazing physicians, and we have Corinne and Garrett, our two PAs, and they are great. So give us a call, let us know what your needs are, and we will help guide you. Amylactin on the body for crepey skin. Amylactin will help. It doesn't stimulate collagen. It has kind of like a urea effect, so it basically helps exfoliate the top layer of skin. So amylactin is really nice if you are have lots of dry scale on the skin, or it's very crusty, or might not have as much shine and radiance. So amylactin can help with that. It might burn a little bit in the beginning, but that feeling goes away with time. Okay. All right. That was awesome. If anyone is interested in doing a consultation, for all of you guys that attended live, you do get $75 off your consultation with us. And then the cost of consultation, that does go towards any treatments that day as well. So let us know if there's anything else we can do for you all. And I hope you at least walked away with 2 new pearls. If you did that, then I feel like I did my job. And if you have any feedback or any other questions, please reach out to our clinic or email me, and I can help answer them for you.